people in government are people of high intellectual prowess. But whatever has been written here has taken a lot of, it is well written as far as I'm concerned. And I think that if we have people like this in government, I believe there is hope for our government. And I want to also appreciate you, sir, for the practical dimension you have brought into it. We're going to take, KBC has a very important meeting he's going to have to attend. He even showed me the invite. He's our father, and he would have loved to be with us till the end. He was here before most of us, and would have loved to be with us till the end. I know that people are still going to join us, or, you know, we had about 383 registrations, but I know that Africans are always the Africans. But what I want you to know is that it's not about the numbers. What God is doing through Czech is amazing. We're going to Lekki next week Friday, and the publicity going on right now in Lekki, you imagine a organization of Ibadan. Right now, I'm aware that CBC, The Nation, Guardian, and one of the Tribune are going to come and cover the event. And we got full approval from the TOs and local government, their councillors, everyone's, and you know, and it's amazing. Let's celebrate God. Let's celebrate God. It's amazing. And sir, we thank you for the opportunity that you have given. When I got there, I told them that we're a community-based organization, and I told them that our grand patron is the operator of Ijeroland and all that. And I got a lot of free access to the chairman, to the medical officer of health. And it's just to let you know that God is helping us to do amazing things. And what I sense in my spirit is that it's going to keep getting bigger. We have a group of doctors from the UK that are already talking about partnering with us. One of them is also speak this morning, and it's amazing. And we want to thank God for our Father that God has used to guide and counsel us over time. And before he leaves, I want us to ask, because I believe this speech from local government is, we need our input from our Father too. Because through him we have learned how to work with the local government and how to get healthcare facilities. He's the one that helped us facilitate the one for Ogbomoso, for the other places, you know. So I want us to take questions. See, I would ask my questions first. Then I will take other questions. Then our doctor will come and answer. Then KBC will come and cap everything up before he goes. My question is, one of the challenges we have now, honestly, is that a lot of young people don't believe in the country any longer. A lot of young people don't believe in the country. People are not traveling out because they hate the country. They are traveling out because people don't believe anything will work. People don't believe in our government. So people ask me a question, how do you guys do it? I mean, a lot of my colleagues are here, but they are so impressed that so these things are possible. It's not as if these things are not possible, but people see a lot of barriers. So my question, sir, is, just as my question, is if you have a young person, whether a doctor or whatever, anybody that wants to give back and wants to work with the local government, either as an individual or as an organization, because there are also organizations too that they want to make community impact, you know, and they will not mind getting the support of local government, working using the leverage of local government. How we have learned a little, and we can still learn more. I don't mind not learning more because we're serious about community. Our focus is not secondary health care or tertiary health care. Our focus is on things that are common. We can leave the other things, which is a big issue, really. I mean, people are dying and suffering from things that can easily be managed at the primary care level. So, how can such individuals, because Czech is also has a lot of daughter organizations. A lot of people that are from Czech have actually started a lot of organizations, healthcare organizations are doing very well. How can they, what's the process for which they can involve the local government, and how can they benefit from the local government? I mean, from partnership or leveraging with local government. I don't know if I got my question perfectly enough, but I know you understand what I'm trying to say, because I know a lot of young people still believe in this country, but they just know how to. But I think running away may not always be the best solution. So I don't know if you have any question. And also because in Czech, we trust God that we'll be working more with local government, because we want to be doing more mega outreaches. And such kind of outreaches, you need to partner. It's better to partner with local government, if possible. Yes. So do we have any question? Please, I want us to take questions. Please just raise up your hands so that we'll take the questions. Yes, one question. Any other? We don't want every other. We have two questions. We are young people.
Efficient healthcare delivery to people of all status. So, aside the other issues which have been raised, there's this contemporary one. That's the issue of patent medical drug sellers, the ones referred to as chemists, around. They aren't trained in pharmacy or the appropriate dispensation of drugs in any way, yet they subserve these duties in the communities. And its impacts in terms of antimicrobial resistance, which affects most tertiary healthcare centers. Personally, I've seen the case of organisms which are resistant to all drugs, which are the common ones prescribed up to the highest level of medications. So, how can, I wouldn't advocate for their complete eradication, but how can the government, in some way, absorb them into the system, perhaps, and use the vigor, their number in helping better access of healthcare, which is efficiency and effectiveness as.
Yeah, I think I got it.
One page of the speech. We saw that human communities without effective and accessible healthcare is an accident waiting to happen. In the same vein, continuous innovation, such as solar-powered supply of energy, cold chain standardization, robotics, and artificial intelligence, have potential for strengthening healthcare at the grassroots. So my question is actually from this sentence. I want to ask, is there anything that is being done regarding this? As we've been told that human communities without effective and accessible healthcare is an accident to happen. And then some things have been told that if these things are put in place, that it's going to help us and also strengthen healthcare at the grassroots. So my question is there anything that is being done regarding solar power supply of energy, cold chain standardization, robotics, and artificial intelligence from the government side? Thank you.
Thank you. So next question.
A lot about the possibility of establishing a healthcare company. For my personal research on Africa, the African horizon, I've seen that there have been little investment in healthcare when it comes to the business world. That's right. People have invested so much in financial services and several other aspects of, services to the nation and to the continent also. So, but when it comes to the healthcare service is very low, very, very minimal. No one seems to be interested about it. So, when I see things happening like around the world, like America and the rest, so I think that healthcare company is actually one of the largest establishments, almost like the technology firms abroad. So I want to know the feasibility of establishing such a thing in Nigeria or Africa, seeing the different barriers and everything. So like the feasibility and also how possible it is to offer great services to continents. Thank you.
Like
911.
exactly. So, and we should also have mobile hospitals. Most of the accidents are highway accidents. Before we get into the hospital, majority we have casualties and majority are already dead. So if we can have mobile hospitals and we have trained expertise, even in the military, that will be able to get them, not policemen that will be acting bring money before we take the person to the hospital, or they don't even have airtime, or by the time you call them, the person is already dead. If we can actually work more on it.
One thing that used to pain me most in this country is because we know our problem really, but we are not doing anything about them. In line of healthcare sectors. And talking about the policies and the innovations, because I realize some problems that are very much in this country. But I know that even we are all seeing this thing, all these things, we are seeing them every day. And one thing I used to say is like the healthcare system of Nigeria is like we are in the 19th century or 18th century. I don't know, I used to say that. because we know that all these things, they are happening. What can the government really do for us in times of innovations? Like our speaker, sir, when he was given the practical aspect, that he was saying they should take us outside for programs and also bring us back. I think those are one of the practical ways. I think what are those practical ways that it can really do to help us? Because if you want to advance the healthcare system of this nation, we really need to work on the policies and the innovations aspects, including the infrastructure, as my sister has also said. Please, I just want to hear some practical ways, because truly, let's be sincere, even myself, like when you said, we don't really have trust in this nation again in terms of healthcare. I also want to leave this country. So that does it. So I just want to know.
There are some issues that we are not allowed to bring into the society or into the community. Like the community leaders will be like, no, we cannot do something like this. For example, female genital mutilation. There are some communities that will not allow you to sensitize the community about stuff like this. So how do we go about it?
About breaking barriers concerning healthcare issues, I want to ask that in this our local government, which is the closest place to the people, how are we assessing what is happening in the sector of about the inflation in the price of our services in the hospital? Because majority of hospitals, you will just see that they review the price and nothing was done. Is it the government that is involved in all these issues, or is within the hospital?
You mean private or public?
I mean the public, sir. So I've been to a public hospital that they were reviewing the price of their services. So I want to ask, sir. Upward or downward? Upward, sir, not downward, sir. So I want to ask, what are government doing concerning this issue, and how can we improve it in assessing a good health?
Health promotion and education, and thought of taking people out of the country and bringing them back. But I don't think that's a new thing. It's been happening before, but I don't really see changes in the healthcare system. I am aware that the number of doctors, especially in this community, have traveled abroad and come back. They traveled for their postgraduate studies and they still come back to Nigeria. But I've not really seen like changes in the healthcare system. So what's the reason for this?
Okay, next question.
And when you were giving your speech, I kind of noted some points there. What I can just bring out here is like there are three aspects in this, what we are discussing today. The citizen, for the first aspect, the professionals, doctors, and the government. I think our speakers have made mention of the aspect of the government, their responsibility towards the health professionals, the doctors, like by sending them outside to go and learn more. What of the citizen? What is the responsibility of the government and the professionals in enlightening the citizen? You know, even in the speech, in the notes, he said the problem of people now is not really about reading or writing, but they to learn, and relearn. What are the professionals doing to sensitize these citizens that don't really know about the benefit they want to get from this thing? And the second thing, I think I said, really working like that in our country nowadays or not. Thank you.
We have administrators in the local government area who are not keen about the medical health system. So how do we bring in proactive youths who are concerned, and how do we break the barrier of, okay, like myself as an example, I'm a medical student, I'll become a medical practitioner one day. So assuming I want to delve into the political system, you know, if I want to do that, there will be the challenge of shoving me away, like, they'll be like, probably I'm female, probably I have to pay some amount of money, there's a lot of bureaucracies I have to cross. So how do we break that challenge? That's the first question. And my second question is that...
Okay, the last.
Yes, sir. The second question is that in our communities, we have a lot of hospitals which does grow up using maternity centers. Like, how is the local government area able to sanction all of these grassroots hospitals? Are there measures that have to be made to ensure that you can operate fully as a maternity center or a healthcare center? So those are my questions.
The local government is a very beautiful tier of government. Not until recently when they are cash crunched. Because I can remember when I was in a youth service or somewhere, when I was working around the local government headquarters, or it's in the rural area, it was very easy for me to access the chairman. Immediately I got to him and I made my intentions known to him that, come here, I'm a doctor, I want to serve you, these are my plans. And these are the limitations. The honorables, the governors, they are like, I feel their pain. I don't envy them. It's very easy for you to walk up to him. Maybe this one is the chief of staff. You talk to him beautifully and stuff like that. You see, they have to censor everything I want to take to the governor or to the chairman. I could remember there was a time, one of our guys there, they gave him I think it was an invite for one of these programs, very good program. By the time he got to the boss, he gave it to him. You know. Then after that, the guy was not talking about his own personal issue. You know what the man said? He said, so you have personal issue and you were fronting this or that. So it's always very challenging. So if you have this group, they were so fortunate to have met Kabesi. Like I said the other time, you still need to know more about Kabesi. The passion he has, even for his domain. I don't think I've seen any king that had that kind of passion. There's something we used to do in Ogbomoso. I'm from Ogbomoso. That we go about praying. There had been a time that I followed and I saw the passion, irrespective of what anybody has to say. If you get to our hospital today, you see there, at least I can point at several, like 3, 4, 5 buildings that we can relate, we can say it's Kabisi that facilitated them. So, my brother, the most important thing is whoever is linking you, you need to know somebody. Because all these assistants and staffs of all those people, it can be challenging. Then don't even talk about civil servants. Those ones, I'm also a civil servant, those ones. Whatever you give them, they have to censor. But if you know somebody like Kabesi, he will just put a call through to the chairman, and he has got no choice. That's why he had to send me here. If not for Kabesi, what's his own? He will not come, No, I will call you, I want you to make it. So that answers your question. Now, the cold chain system in Nigeria, we thank God for solar power energy. If not because of this, we would have been able to achieve it. When COVID vaccine came, when we were talking about, the first one was Pfizer and Moderna. It became so challenging to use it in Nigeria because of the temperature. If you get to, there's no PHC you get to in Nigeria, that you're not going to see a solar-powered refrigerator. And it has been done such that the temperature is so low. So, as per using technology to keep the cold chain and some other things in the local government. I don't work in the local, but I know this. At least I did community medicine, so I can say something. You understand? So that's all I have to say about that. Is the chairman that can answer some further questions. Robotics and artificial intelligence. How can... Okay, now, see, these patent medicine sellers and quacks, see, it's funny. I've come to understand that our people seem more comfortable to go to those quacks than coming to professionals. They don't want you to tell them, you want to tell them what will be good for them. Like, for instance, a guy is here, somebody who has had a cesarean, a previous car, and the second pregnancy, she has been thinking, I want to do VBAC, vaginal birth after cesarean. And at 36 weeks, the ultrasound said breech presentation. If you now tell them, when they come to the hospital, tell them, Madam, you have to deliver via cesarean. They will hate you because you are telling them the truth. But they want to go to a place We are a stupid quack. We tell them, don't worry, and so by the time they cause trouble, they will not allow us to sleep. I hate that thing. Somebody will go and cause trouble, and somebody will be calling me at 1 a.m. that we have an emergency. Sometimes I get angry. So that is how our people are. But on the part of there are government rules and regulations. There's a department in the Ministry of Health that sees to this. Directorate of Secondary Health. But you see, this is Nigeria. You as the director cannot be like, oh, I want to work, I want to get it. By the time you take a step, somebody somewhere will call someone, and that person will call the governor, and the governor will just be like, don't pay me. I cannot say no. And once they release that person, I say, okay, what will you do? So it's the problem of the country. The people saddled with the responsibility are doing what they are supposed to do. There's a list of health centers run by quacks. Yet they are making money, they are buying good cars, and some people are still going there because they prefer to go there. There was a time somebody staying in front of my house. Most times I don't look at people, I just go my own way, I don't have time. It was my wife that noticed that the child had been sick and they've been giving the child drugs. A 2-year-old girl like that. She now said, okay. By the time my wife told them to come to me, I sent them to the lab, they did tests, and they got treated. They didn't spend up to 1,000, the government hospital. They didn't spend up to 1,000. When the child became fit, the guy was not telling that he has spent about 9,000 naira in one patent medicine seller's place. That's a place of knowledge. The Bible says, my people perish because of lack of what? Knowledge. So that answers that. Then the feasibility of establishing, I didn't get that question. Health company, what did you say? Healthcare. Well, one thing is there are some things that are solely, it's not even within the purview of the chairman. You know how it works in Nigeria. After federal government is state, local government is just, they are not operating the way it used to be. So it's not within the purview of the local government, but it is government that can do that. Government has to create an enabling environment. So you want to tell me that somebody who is the minister of health, who is a doctor, who is a surgeon, you want to tell him he's an idiot? He knows the right thing. But when you raise a memo, and you give it to a leader who is not interested, governors and president, they have power. Irrespective of what you have in your brain. If they are not interested, they are not interested. Wait for your time. Sure, you understand me? So now you guys are coming up. You have the opportunity to change the country. Good for you. And if you cannot change the country, yes, now, but in your own little way. We try to do so many things, even in our own little environment, we want to change things, but it's so frustrating. If you are like 10 in a place, in a workplace, and it's only you try to, let's make this thing work, and 9 are doing otherwise. 9 against 1. Who will win? Thank you. Emergency services in Nigeria. Well, I think some states are doing that. But the coverage is not encouraging. You understand me? Ideally, there should be, I was listening to something on the radio this morning. Ambulance is in Osun State. I know that one. So maybe there's an accident, they will call them. But you see, I look at that thing. Is it working the way it should? There's what we call emergency preparedness. When they create an emergency service, and the people that are there, maybe at the time you are calling them, they are somewhere doing one, somewhere. They don't even have a roster. When you are doing that kind of thing, you should be ready at all times. So in Nigeria, needless loss of life is the order of the day. So I think it's in Nigeria, but the government, the coverage, they will just put it in state capital. That's one thing I hate in this our country. Everything will be in the state capital. They will neglect the internet. Most of the people that are in the state capital, they have the wherewithal to access, and they have, look, in this Ibadan, you have usage, you have Adeoyo, you have very big ring road, but you will not put everything here. Why don't you take it to, Igono? That's an internet, but a lot of people want to, if they post you to Ghana, you want to go. Most of our doctors that go there, they go there grudgingly. Sure, you understand me? In fact, in this time that you have security challenges. So that's that. Now, practical ways to achieve, practical ways. That's The government will tell you that. You know, you're asking me as a local government chairman. I'm not a local. I can never be a local government chairman. That's the truth. But I think it's government that can. You know, there are practical ways now. It's not me that will tell you. You know, the government. I know from what he said here. I know for every month there will be granting. I think all the departments will submit their maybe their running cost or something to the local government, and in their own little way, within the confines of the available resources, they will do the needful. But for everything in Nigeria, everything revolves around federal government. Every program that started, it was this man, when he was governor of Ondo State, he did this maternal and child health thing, Mimiko, where if you are coming to the hospital for delivery, be it cesarean or anything, it's almost like very free. I think states can, also now, Oyo State government, they have started OSHA. OSHA is doing a lot. What it means is like an health insurance. You put in your money, maybe little sums of money. For we that are civil servants, they take it from our salaries. So that anytime, you know, health is, you cannot predict anytime you are going to have ill health. So when you have, you don't have to have money in your pocket. You can easily go to the hospital just with your identity card. You understand? And so that is all about that. Then now, what you were talking about, there are some places where they will not. There was a time when I was in a medical school, when I was still under the tutelage of our guy. I finished from Lautech. So that was very special about. So I now, you know, we're trying to give polio vaccine. I was an independent monitor. So there was one shop that we got to. They said, this person is trying to avoid giving it to me. I was like, what happened? When we got there, the guy said, I put on fishy stuff like that. In fact, they almost beat us up that. Now the point is this: when you find yourself in that kind of situation, safety first. But in this era of social media, and even let's assume that there is no coverage, network coverage, you could have radio and stuff like that. People, they talk about things like that now. So it's just that some people are just stubborn, or they just want to remain archaic. This is how it is done. We don't want to change. Sure, you understand me? So you can always reach people. That was what failed me in pediatrics. So when I was doing end of posting, I told Dr. Emily, he asked me, they were talking about, I had a patient that had opistotonus, tetanus. So they was asking that, okay, why do you think this child didn't take immunization? I was like, because they stay in the area. It was not, and I made it. It was like, but they used to do this API now, that they move about house to house immunization and stuff like that. I feel that thing. I scored 45. So sometimes you need to be very careful when you raise such. Now, you see, as per the issue of raising costs in government hospitals, you don't know what people are going through. People that are heads of hospitals in states, and I don't envy them. Or is it Lautech? Is it Lautech that I want to envy? I can't envy them, because you can write a long list, you can have a running cost of 100 million. If government does not have more than 10 million, that's what they're going to give you. And you have to keep running the hospital. What will you do? What will you do now? The head will be seen as irresponsible. Will you now walk and tell the governor that the hospital you cannot go ahead? It doesn't work that way. I don't know what you do, you understand? I don't know what you do, but when you get there, you understand. So they just have to readjust and there was a time they started collecting a small amount of money in our hospital just to make sure things work. So they had to come to Ibadan to go and take approval. Okay, how can you run a state hospital? A state hospital is like next to a teaching hospital. You understand? You want to run that, and they are giving you 70,000 every month. How do you run it? So it means if they give you the appointment as the head of the hospital, they expect you to use your initiative. So it's very easy now. Students, you want to raise several questions, and if I start my own now, you want to raise questions for me, and destroy me. So then now you're talking about see, let me tell you, that's the problem we have in Nigeria. I said the best thing to do is to, when they are, and that is how some of these countries develop themselves now. You know how Israel that became the largest producer of fruits in the world, did you know how they did it? So is it an individual that will do it? See, we should not indulge our government. What they did, once Israel sees a fruit somewhere and they know it can't grow in their own country, you know what they used to do? They will dig a very big, something like a pit. They will now go to that country. They will excavate their soil. They will now come and fill up that pit. Then they are going to plant something there. So can an individual do that? No, now. So it's the government that should do that. If this country has been doing that, we won't be where we are. Like, we have consultants. This is my organ, he's a gynecologist. If there are new trends in the US, the UK, how many researches are we doing here? We are too dependent. When COVID-19 came, were you able to bring up anything? We had to rely on the advanced nations. Okay, why don't you just select a few, pick around the teaching hospitals, pick gynecologists. Okay, there's a new trend somewhere. It could be the state, it could be anywhere. Let's sponsor you people. Go and do training 2 years. While they are doing that training, just like sabbatical, their salary should go on. You understand me? Then they will have some allowances, whatever, and wherever they are going to create an enabling environment for them. Once they are, it's like you sign a bond, you finish training, then you come back and come and step it down. By the time you do it, you know what will happen to the health sector in Nigeria. So that's what government should do. So if I use my own money to go and learn something, if I'm going to apply it at all, it will be in my private facility. IVF, did it start in tertiary health facilities? No. In Nigeria, it started in private places. And most of the people that were doing IVF, they were teachers. Most of them are teachers in tertiary. You go and use your own money to learn something and you come here. It doesn't work that way. Let's be practical. Let's be practical. And even at that, we see some of our guys that even at that, they will still teach somebody that is very close to them, who comes around to help them in this course. And from there, that person will pick 1, 2, 3 knowledge and and they start pushing. So that's how it works, my brother. Then, effort of the professionals. What do you want to professionals? Bad obstetric history. She was so lucky. She had another pregnant. She lost one, fresh stillbirth too. And about 2 months after, she got pregnant again. I didn't know her based on the history she gave us. She now came at that. I said when she went to do scan, she saw that her pant was wet. It was okay, go and do scan. She went to do scan. The scan says severe oligohydramnios. I called the guy, I said okay, go and deliver her via Caesar. We told her. I explained to her, we are ready for you. Okay, said she will go home to go and tell the husband, and she was going to come back. We didn't see her up till today. Is it my fault? It's not my fault now. I will do my. See, even doctors do a lot in the health sector. And nurses. Mama, you see, the nurses, sometimes I get angry with them because they will be preaching. After talking to somebody that is sane, somebody that is not a crazy person, you will tell them implication, you talk about everything, you won't know when you start talking about pathophysiology. You understand? Because you just want them to know the implication of what is wrong with them. But at the end of the day, if a patient decides, because it's not a prison, I can tell you this is what you're going to benefit from. Unfortunately, that is the problem. I don't know what we can do about this. If a patient comes, after explaining to them, and they say, no, I want to discharge against medical, they do that. There was one patient I sent to Lautech yesterday, sir. That little girl, she had a criminal abortion, from one quack. We were even planning to do MVA for her. But I told my wife, I said, look at the way the lady came. She came bent. Are you sure they have not perforated something? By the time yesterday told me she was passing blood stool and she was having hematuria. Kia, take away to the Lautech. It has become Lautech problem, not our own problem again. So you understand. So what do you want networkers to do? Maybe you are beefy networkers, I don't know. That's why you are putting at our table. Local government begin. I didn't get this one. Start with government. Yes, now doctors. They tell you go and open first. By the time you open, so after some time, and because these people too, they have the manpower is not encouraging. At least they have manpower and the running costs. If somebody is in Ibadan and is the director of secondary health, the only way he can is by doing monitoring to know that there are things. Now, is it his money, is it his salary that he's going to be using? Government has to make available vehicles, manpower, resources, and everything. When it's not available, what will they do? So they're like, their hands are what are tied. So I think that's all I've been. So thank you for the questions. You almost knocked my head.
Thank you very much, sir. I know there are so many things some of us may not understand because in most of us are students, you know, but as you grow older, you will understand. But be learning these things right now. By God's grace, we in Czech, we are still trying to engage more. We have a lot of professionals in Czech, a lot of people that are not students, but we are deliberately building a strong youth arm because we know that youth are going to play a place in the future of this country while we are still developing our professional arm, you know, and that's very, very important. So Dr. Atanda, we're very grateful, sir. Thanks for the practical advice, and I hope you all jotted and took it seriously.